Hello, smart nurses. Let's discuss insulin in today's lecture. So, insulin is defined as a hormone produced by the beta cells of the islets of Langerhans in the pancreas. So, our body is able to manufacture or produce insulin. So this insulin helps glucose move from the bloodstream into the body cells where it is used for energy. So without insulin, what would happen is that blood glucose will rise. So in an instance where, or in an incidence where our bodies are lacking insulin, meaning the pancreas is not able to produce insulin, to be specific, the islets of Langerhans of the beta cells, if they are not able to produce insulin, it means there will be a rise in the glucose levels in blood. And when glucose only remains in blood and is not transported into the cells, that means there will be cell starvation. So cells will be starved and they will have no energy. Then when that happens, the body starts breaking down fats and protein so as to compensate for the energy which is not there in the cells. And then because of this process or because of these mechanisms, complications such as diabetic ketoacidosis can occur. So, first of all, let's talk about what the function of this insulin is. So, insulin helps us to, one, it helps us to lower blood glucose levels. Then, it also promotes glucose uptake into the cell. Aside from that, it also promotes storage of glucose as glycogen in the liver. Then it also promotes fat storage and promote protein synthesis, as well as prevent the breakdown of fats and proteins. Okay, so uh, let's quickly talk about the types of diabetes. Since we are saying insulin prevents glucose from accumulating in the bloodstreams, so the only condition that we know in which there is increased blood glucose levels is called diabetes. So meaning insulin is a drug that we give to people who are diabetic. So just a quick one. Let's quickly revise the types of diabetes that may occur and that may require insulin. So we have what we call type 1 diabetes. So under type 1 diabetes, the pancreas produces little or no insulin, and patients require lifelong insulin therapy. So in type 1, they are also called insulin dependent, because in this type, we are calling type 1 diabetes, the pancreas produces little or no. And then, if you recall, smart nurses, we said insulin is a hormone produced by the beta cells of the islets of Langerhans in the pancreas, and it helps glucose to move from the bloodstream into the body cells. So, in type 1, these pancreatic cells are not able to produce insulin. So that is type 1. Then in type 2, the body becomes resistant. So look at the pancreas, right? The pancreas is busy secreting or manufacturing insulin, but the body cells are not able, or should I say, the body becomes resistant to this insulin. And some patients may eventually require insulin at the end of the day, because in as much as we have enough insulin, but this insulin is not being used by the cells. There is not that compatibility by the cells. So in the long run, cells get damaged and they require insulin. That's the second type of diabetes. Then the third type of diabetes is called gestational diabetes. So you know gestational diabetes, this is the kind of diabetes that comes out when? Exactly when a woman is pregnant. So this one sometimes it is also managed with insulin. Okay, so let's quickly classify this insulin. So when it comes to the classification of insulin, this is the most important pharmacological section that you smart nurses should clearly get and understand. So when we talk about the classification of insulin, insulin is classified into what we call rapid acting. Aside from that, we have short acting, and then we have intermediate acting, and finally long acting insulin. Let's run through that quickly. Classification of insulin. First one, we have rapid acting insulin. Then we have short acting insulin. And then we also have intermediate acting insulin, and last three we have long acting insulin. So let's drop down some examples of these insulins. So when we talk about rapid acting insulin, examples of rapid acting insulin include Lispro, Aspart, Glycine. So when we talk about the characteristics of rapid acting, okay, so when it comes to their characteristics, these ones works very quickly and given immediately before meals. So you give rapid acting before the patient starts to eat. So you have to give these ones so that as the body is trying to organize them, then the patient begins to eat. Meaning, as they eat, the glucose they are eating, there is already insulin in the blood that is able to take it into the cells. Then, when it comes to the pharmacokinetics of rapid acting, one thing you must know is that the onset, once you give them, in a short period of 10 to 30 minutes, they begin functioning. Then they reach their peak in about 30 to 90 minutes. So altogether, the duration is about 3 to 5 hours. So rapid acting duration 3 to 5 hours. Okay, examples, Lipro, Aspart. And then they are given, when are they given? They are given quickly, immediately before the patient begins to eat. Now, as you give rapid acting insulin, there are some nursing considerations you must never forget or you must always put in place. These nursing considerations are that ensure patient is ready to eat as you are administering. So the food should be there, the food should be ready, and then you administer. Then monitor for hypoglycemia. So the moment you give your patient that rapid acting insulin, quickly monitor for hypoglycemia. And also, when is it used? This one, it is used for mealtime glucose control. So rapid acting insulins, they are just there to control mealtime glucose. Okay, let's quickly jump into short acting insulin. So an example of short acting insulin is what we call regular insulin. Now, regular insulin can be given in IV. It is a clear solution and it can be given via intravenous. So this one, it's a clear solution. It looks like water and it can be given via IV. So when you talk about the pharmacokinetic of regular insulin, pharmacokinetics, again, its onset is between 30 to about 60 minutes. Then its peak, it's about 2 to 4 hours. So that is where it differs. With the short acting, the peak was about 30 to 90 minutes. But uh, with the rapid acting, the peak was about 30 to 90 minutes, and then with the short acting, the peak is about 2 to 4 hours. Then duration is somewhere 5 to somewhere 8 hours. Then one of the most important exam point you must never forget, smart nurses, is that regular insulin is the only insulin commonly given intravenously. Get me clear. Regular insulin is the only insulin commonly given intravenously. So, when do we use this regular insulin? We use it mainly during diabetic ketoacidosis and also hyperglycemic emergency. So regular is mostly used in emergencies because DKA, which is diabetic ketoacidosis, is an emergency as well as hyperglycemic emergency. Okay, the third one we said is called intermediate acting insulin. So examples of intermediate active insulin is neutral protamine hagadone. So it is abbreviated as NPH. Okay, so neutral protamine hagedon. So this is an example of intermediate acting insulin. When you look at its characteristics, this one is cloudy. Remember, when we talked about the short acting, an example was exactly regular insulin. We said its characteristics is that it is clear and administered IV. But when you look at intermediate, the intermediate, this one is cloudy appearance and it is a longer acting compared to the other one. So this one is cloudy, the other one is clear. So onset, this one, the onset is about 1 to 2 hours. Then it reaches its peak in about 4 to 12 hours. Then duration is somewhere 12 to 18 hours. Again here, the nursing consideration that you must always put in mind as a smart nurse is that you should roll gently before use. Do not shake vigorously because it is cloudy, so don't shake vigorously, just roll gently, okay, before you use it. And then lastly, we talked about the long-acting insulin. So an example of long-acting insulin is glargine or glargine. I don't know how to pronounce it, but glargine, as long as you know how to spell the word. Okay. So we also have, I think, degludec. Yeah, degludec is also an example of long-acting insulin. So characteristics of these ones provides basal insulin coverage and usually given once daily. Their onset is about 1 to 2 hours, and then usually they have no peak, and then duration is about 24 hours or more. But the good part about this long acting is that uh, they are used for stable blood glucose control, and they have a lower risk of hypoglycemia. That's the good part about this one. Okay, so hopefully that was clear. If it was clear, let's quickly jump and talk about insulin administration. So this insulin we've talked about the definition, its use, types. Now, how do we administer insulin? So insulin is usually administered subcutaneously or subcutaneously. Then it is only regular insulin that is mostly given IV, but the rest they are given subcut, which is subcutaneously. Okay, so when you talk about administration, one of the things that you must understand, smart nurses, are the sites. Which sites do we use for administering this insulin? So if you look at this good picture that I brought for you, on your left bottom, your bottom left, yeah, you're going to see these two gentlemen. So these two gentlemen are showing you sites on where insulin is administered. So insulin is administered on the abdomen, and on the abdomen is the most fastest absorption. So it is the most preferred. So abdomen is good because it is easily absorbed. Then it can also be administered on the upper arm, as you can see, where there are those green parts on the upper arm. You can also administer insulin from there. Then it is also administered on the thighs. Aside from the thighs, it can also be administered on the buttocks. Okay, so why do we have so many sites of administering this insulin? It is because we are afraid, or we are trying to prevent three things. The three things that we are trying to prevent by injecting insulin on the same site is one, lipodystrophy. Aside from lipodystrophy, we are also afraid of tissue damage and poor insulin absorption. So we tend to be rotating. If today you administered on the abdomen, tomorrow maybe on the thigh, the other day on the shoulder, the other day on the buttock, then you go back on the abdomen. So as we rotate, we are trying to prevent what? Lipodystrophy, then tissue damage, as well as poor insulin absorption. Now, whenever we are administering insulin, as nurses, as smart nurses, there are steps that we should follow. Now, these steps include: one, make sure you wash your hands. And then, after washing your hands, you verify the prescription. Then you check blood glucose levels. Then you prepare insulin correctly. Aside from that, you have to select the injection site. Then you clean the skin. Then you pinch it a bit. Remember, I said insulin is mostly given subcut, so you have to pinch the skin a bit so that you are able to give at an angle of 45 to 90 degrees. That's if when you pinch, then you can give it an angle of 45 to 90 degrees. So don't pinch much, just a bit, just a bit. And then you inject insulin slowly. You do not rush. You inject it slowly, then remove the needle safely, and also dispose the sharp uh, properly. You have to dispose the sharp properly. Okay. So, uh, let's see. What else should we talk about when it comes to insulin? Okay, let's talk about the storage. Storage is also important. So when it comes to the storage, if the valve is an open, then you can keep it. It can be kept refrigerated at about 2 to 8 degrees Celsius. But if it is opened, it can remain at room temperature, but avoid excessive heat. So meaning you avoid exposing it to heat as well as to direct sunlight. Then, if in an instance where there is a need for you to mix two different insulins, then what happens is, because sometimes regular insulin can be mixed with NPH insulin. So when you are mixing, the rule that you follow is draw clear before cloud. So meaning you draw the clear liquid or the clear insulin before the cloud insulin. And you as smart nurses, I know we remember that between regular and NPH, the one that is clear is regular insulin. And it is also the one that can be given IV. And then you have the NPH, which is cloudy. So as you are mixing the two, you start with the clear and then you add the cloudy. Okay, so now we know every drug has got its complications as well as its side effects, obviously. So when you talk about complication of insulin, you can talk about things like hypoglycemia, which is the most common complication. This one, the causes are excess insulin and also skipping meals as well as excess exercising. Then the signs and symptoms that you might see might include sweating, tremors, hunger, dizziness, oh yeah, even tachycardia, as well as confusion and irritability. So all these can be signs of hypoglycemia. Then how do you manage this hypoglycemia? So if the patient is conscious, you can give glucose. If the patient is conscious, you can give glucose. You can also give juice or sugary drinks. But in an instance where your patient is unconscious, just give IV dextrose and also glucagon injection. That can help. Another complication is lipodystrophy. So lipodystrophy is nothing but just abnormal fat distribution due to repeated injection in the same area. That is why we rotate. We don't inject in the same area. We prevent lipodystrophy. We prevent those fats from distributing in that area. Then another complication can be allergic reaction. It is rare, but it is possible. And some of the signs that you will see when someone's got an allergic reaction to insulin can be a rash at the site or swelling, as well as maybe itchiness. Okay. So, as nurses, our responsibilities when it comes to this insulin, um make sure we are checking the blood glucose before insulin administration. So before you administer, whether it is fast, rapid acting, whether it is short, whether it is medium, intermediate, whether it is long, make sure you check for glucose levels to avoid hypoglycemia, and also ensure the correct insulin type. So you should make sure you ensure the correct insulin types. We have talked about the types, and also confirm correct dose, monitor for hypoglycemia, teach patient about insulin use, teach proper storage of insulin if it is opened, if it is not opened, just like we have discussed. Also ensure patients they eat properly so that we avoid the complication. Then as a smartness, make sure you teach your patient how to inject insulin, because these patients, they are not kept in the ward most of the times. They are sent back home. They just live a normal life. So teach them how to inject. Also teach them signs of hypoglycemia. Also teach them how to monitor blood glucose. Also proper storage, and teach them concerning meal timing, and also site rotation, so that they are not injecting on the same site. Okay, so I think basically that's it about insulin. Maybe side effects of insulin, we can talk of hypoglycemia, weight gain, injection site pain, lipodystrophy, allergic reaction. I think we've talked about this. Let me see what else. Mm, okay, I think that's it. So, some of the most important exam questions that we must know as smart nurses, or the common questions that are asked when it comes to insulin and also diabetes, are that they might ask you to say maybe which insulin can be given IV. And what is the answer? Come on, I can get you. Which insulin can be given as IV? Exactly. Regular insulin. Then if they ask you to say which insulin is cloudy, the answer is NPH insulin. Exactly. Then if they were to ask you to say maybe which side has fastest absorption, the answer is abdomen. Excellent. Then what is the most common complication if they ask you what is the most common complication of maybe insulin therapy? This was the commonest complication amongst all is hypoglycemia. Then if they ask you to say maybe what is the rule when mixing insulin, always remember it's clear before cloud, meaning regular before NPH, clear before cloudy. Okay, so okay, I think that covers all about insulin. Maybe just a quick memory aid. So just remember rapid acting insulin for fast meals, long acting insulin for basal control, and then always it is clear before cloudy, then abdomen absorbs fast. Okay, as nurses, mastering insulin administration is not optional, but it is a life-saving skill. All right, smart nurses, until next time.